Hello and welcome everyone. My name is LaSalle Perez-Rogers and I am the Program Manager for the Campaign for Inclusive Care at the Elizabeth Dole Foundation. The Campaign for Inclusive Care is a joint initiative between the Elizabeth Dole Foundation and the U.S. Department of Veterans Affairs aimed at shifting the culture of care at VA to be fully inclusive of military and veteran caregivers by embracing, engaging, and empowering caregivers as members of their veterans' healthcare team. We're excited that you are able to join us for today's Caregiver Community Connection, or C3, presented by the Elizabeth Dole Foundation and powered by our partners and friends at Wounded Warrior Project. Today's C3 episode, What Matters Most, Supporting You with Advanced Care Planning, is in collaboration with the U.S. Department of Veterans Affairs. This topic was chosen from conversations with caregivers, Mary Han Ward and Laura Gary, highlighting the importance of mapping out care preferences for you and your veteran. Starting this conversation ensures that both you and your veterans' voices are heard and included in healthcare planning and decisions. Before we get started, I wanted to mention to all attendees that this session is recorded and will be available in the Guides tab in our Hidden Heroes Caregiver community and on the Elizabeth Dole Foundation C3 website. Today's moderators, Marianne Delatorre and Leah Helwege, will be hanging out in the chat box. Out of respect for our presenters and fellow attendees, we kindly ask you to keep your chat comments related to today's topic of advanced care planning. You may also submit any questions you have throughout the presentation using the Q&A box located in the Zoom control panel. We will be taking note of all the questions submitted throughout the episode, and we will have them answered during our live Q&A. We will also be selecting 4 participants from today's episode to win a free special prize. To be entered into the drawing, engage with us in the chat. Lastly, today's episode features closed captioning. If you would like to disable it, go to the live transcript button in the control panel and click Disable Auto Transcription. It can be disabled at any time during the episode. And now we are so excited and pleased to introduce Laura Taylor and Gisa Hernandez, who will help lead our discussion on advanced care planning. Both Laura and Gisa are licensed clinical social workers and come from the Advanced Care Planning via Group Visits program in the Veterans Health Administration. Laura Taylor serves as the National Program Manager, and in this role, she builds stakeholder relationships and is responsible for managing, directing, and overseeing the implementation and dissemination of advanced care planning. Gisa Hernandez serves as the National Project Assistant, and in this role, she provides coordination and support for the implementation and sustainment of advanced care planning. And now, please join me in welcoming Laura and Gisa.
Wonderful. Thank you so much, Lizelle, and hello, everyone. We are delighted to have the opportunity to speak with you about advanced care planning, a topic that we are really passionate about, and also to be able to share just a little bit about the group visit program that we're working to spread across the VA system. Before we jump in, I thought it might be helpful for me to share a little bit about the reason I chose to work at VA. While I personally have not served in the military, both of my grandfathers are World War II veterans. I was raised by a 4th-generation Marine who was severely injured in Vietnam. And as a child, I spent quite a bit of time accompanying him to VA appointments. These experiences as a hidden helper had a profound impact on my career aspirations and my life perspective. My spouse is a former military police officer, and I consider it an honor to work at VA because it allows me to give something back to those who've sacrificed so much. The next slide, we are going to jump right in and share a little bit about a story of a caregiver with you. So we are on the Susie story slide. Yep. So at the beginning of the year, Gisa and I had the distinct honor to meet Susie. She is an amazing caregiver and a peer mentor in VA's caregiver support program who penned an open letter to fellow caregivers, which she hoped would make a difference for all of you and for others. Her letter urges other caregivers to engage in advanced care planning. And in the letter, she shares a story about her niece. And I'm going to try my best to share that story with you. We also will link her letter in the chat box so that you can have that information as well. So within Susie's letter, she talks about her niece, who the niece and the niece's husband unexpectedly became ill to the point with COVID, and to the point that the husband he went into the ICU while Susie went home with oxygen support. A few days later, Susie's condition got worse and she needed to be hospitalized as well. And the attending physician for her husband came to her hospital room and said, "I need to know what you would want us to do if he takes a turn for the worse." So here she is, feeling pretty terrible herself, while being asked to make a bunch of decisions that she had never talked to her spouse about at all, had no idea, what his wishes may or may not have been. And she was needing and being expected to make a bunch of decisions very rapidly under a lot of pressure, really in the middle of this crisis. So we're going to talk that through as we go through our presentation today, but I wanted to share that story because if you take nothing else away from advanced care planning, one of the important points is unexpected things can happen all the time. So on the next slide, for those of you that registered, you may recognize this question. And for others who are participating who maybe didn't register, we invite you to respond within the chat box if you feel comfortable doing so. The question is, have you thought about what you would want if you were hurt, injured, or sick and could not communicate? And we'll just give a little bit for folks to weigh in about this in the chat box. Okay, and I'm seeing some responses come in here. I will say that for the majority who did register, the answer to this was yes. But if you said no, you're right where you need to be, and we're very glad that you're with us, and we hope that our presentation will give you some things to think about in this space of what you would want if you were hurt, injured, or sick and could not communicate. The next question we have for you is, have you thought about your treatment preferences if you could not communicate during a mental health episode? And I'll give a few seconds here again for you all to weigh in on that as well. Yeah. So during, for the registration, about 30% answered no and about 70% answered yes. So the majority was yes responses for that one. Let's move on to our third question, which is, have you talked with someone you trust to make healthcare decisions for you? Have you talked with someone that you trust? I see some yes, absolutely coming in on the chat box. Yes. Yes. Okay, for the registrants and those of you that answered there, about 40% said no, they've not talked, and about 60% said yes, I've talked with someone. So our fourth question here, we'll move on to the next slide, is, have you filled out an advance directive? And I see the response, yes, but I need to put it in writing. So that was a good one to tee us up for this question. And I'm seeing some no's, some yeses. Oh, someone has completed it, but it's a little dated, okay. All right, so 56% that registered said no, I've not filled out an advance directive, and many of you have said that too in the chat box, and that is okay. For those of you who answered yes, a follow-up question you may want to consider is, have you reviewed it or renewed it, if needed, in the past year? So we use these types of questions to help kind of set the stage a little bit about what we're going to talk about today and really what we're going to focus in on during our group visit experience. And we want you to kind of think about everything that we share today. And then when Jisa, toward the end of our presentation, Jisa will talk to you about how in group we use the next step to kind of wrap things up. So just be thinking about what we're sharing and maybe if there might be a next step you may want to take. We'll move on to the next slide. So advanced care planning can be pretty abstract. And as I've already kind of seen coming through the chat box, it makes a lot of people think about a lot of different things within this space. And a lot of the terms can be a little unfamiliar, even to those of us who work in healthcare. We just get them a little confused or mixed up or whatever. And so we're going to see what we can do to sort some of these things out with you in the time that we have today. And on the next slide, we'll jump right into what exactly is advanced care planning. And really, in the most simple way that I can put it, it's talking about what matters to you with the people who matter the most to you. So when you consider the questions we just asked, you could also think about it in relation to kind of, I need to think about what my preferences are. I need to talk to the people I love. And it may mean that you complete an advance directive. It may not. That may not be something that you think you need. But ultimately, advanced care planning can help you gain control for your future care. And also for those that you care for, if you put some advanced care planning in the documents in place. So we will move right along, and I'll tell you that research supports that engaging in advanced care planning increases the likelihood that a person's healthcare wishes would be followed. So if you think about the story I shared through Susie's experience, how was the spouse supposed to follow something she didn't know? She didn't know what, here she was being asked to make a decision, but didn't know what the preferences even were to be able to kind of weigh in on that in an informed way. On the next slide, research also supports that advanced care planning can reduce caregiver stress, depression, and anxiety. So again, if you think about the story I shared, if the family member that Susie talks about sort of knew what those preferences were, it may have made her feel more confident in communicating to the physician what needed to be done, what didn't need to be done, and really kind of help to reduce some of that pressure that was happening within that crisis at that time. I will also say, although it's not on this slide, that when a person is required to be a decision maker or sort of put into that role and they are unsure, sometimes, they make decisions, they do the best that they can in the situation, but sometimes after that is over, whatever the outcomes may be, it can also kind of lead to a prolonged grieving process potentially if the person is still wondering, did I do the right thing? How do I know for sure? Because I never, I'm just not certain that that's what the person would have wanted. On the next slide, this one should be very familiar for the C3 community. I know that all of you are familiar with the RAND study. And within the study, I just wanted to kind of include this slide and this information so that we could really connect the dot back to the findings in the study. Of course, all of you could teach me, I'm sure, that military caregivers experience more health problems. That was one of the key findings within the RAND study. And we know that caregivers often consider advanced care planning for the person they're caring for, but don't always maybe think about it in relation to themselves. What would I want? What is really important to me if something unexpected happens? The other thing about advanced care planning for the caregiver is that potentially the caregiver could include as part of their advanced care plan, what is the backup for my care recipient if something unexpected were to happen with me or my health, and I wasn't able to communicate, who would I want to, be contacted? Who would I want to step right into the caregiver role? What are the plans as it relates to the person that I'm responsible for providing care to? On the next slide, we get this question like, well, when should I have this conversation? Should it be this big, real formal sit down meeting where it's very serious and, we all get around a table, or really, kind of a solemn conversation? Or exactly when should I have this conversation, and how should this sort of look? And what we like to share with people is you should have the conversation early, often, before, after major life events, anytime you potentially are taking a significant travel or trip, and obviously during a new diagnosis, particularly if it's a serious illness. So I'm just going to go through a couple of these a little bit more. I think most of the content we have here is a little self-explanatory, but the early category, for those of you who are caregivers of a veteran, you know that this was just part of their probably service experience, right? They had to sort of fill out and have a plan that included advanced care planning as well as a lot of other kind of components of their life and responsibilities to have a contingency in place if something were to happen or during a deployment, etc. So we really are staunch supporters that we need to have these conversations once someone becomes an adult, and we need to continue these conversations over the life course. So, ideally, when someone's feeling healthy and has no medical kind of crisis or any major medical anything or mental health concern. The major life event category really has to do with if you are to have an advance directive and a major life event happens, it's good to look at that and make sure that, if there were a marriage or a divorce, et cetera, that you've updated that so that it really reflects kind of your current situation and your current status. The other thing I'll note here is if there is a death in the family, it can bring up strong feelings or conversation. Sometimes, we get the question, and I think there may have already been some questions around, well, like, how do I initiate this conversation? And one thing that we found that's helpful is to kind of, live life. And as things happen, for example, a death in the family, it may bring up naturally some conversations in this space. Perhaps yourself or the person you're providing care to had strong feelings about how that situation was handled or not handled, or who was involved or should have been involved, or got left out, or, it just may bring up some real opportunities to initiate, oh, you thought that was wrong, the way this happened. what would you have wanted, or how would you have wanted that handled differently if that were you? So it really does present kind of just a naturally occurring fact of life situation that can lead into really a meaningful conversation about that person's preferences. I didn't used to think about the major trips, but I will say I need to share it with all of you because unexpected things happen all the time. And it's possible that you and the person you've named as your decision maker go on a trip together. And if something unexpected were to happen, it's possible that there might need to be someone who's the backup to stand in to be a decision maker in that scenario. Or it's also possible you may take a trip with somebody who has no idea that you even have a decision maker named, and if something unexpected happened, they wouldn't necessarily know to tell the healthcare team, hey, you need to contact whoever your decision maker may be. So when you're doing your trip planning, you might want to fold it into that process as another sort of checkpoint in making sure that people around you are aware of that you've got that basis covered as far as advanced care planning goes. On the next slide, we will just really dig into what is an advance directive. And an advance directive is a written statement or statements that if you do the signatures properly, as per your state regulations, or if you're in the VA system with the required 2 witnesses, becomes a legal form or forms. And within those forms, you can write down your preferences for future healthcare that you want to be used if you aren't able to communicate what those preferences are. The VA form has 2 components to it. One is the durable power of attorney for healthcare component, and the other is the living will component. Some states, for those of you who are not a veteran, some states have actually these forms are 2 separate forms. So whether they're 2 separate forms or they're both part of the same form, the most important thing for you to know is you can do either one, the durable power of attorney for healthcare, for example, where you want to appoint a specific person. This is who you want to make healthcare decisions for you if there ever comes a time when you cannot. Or you can do the living will, which maybe for whatever reason in your situation, you don't want to appoint someone, but you have really strong feelings about your own care preferences and what you do want or what you do not want. You have strong preferences, for example, about the care plan, your responsibility as a caregiver, and you may want to put in that living will to make sure that your care recipient is left in the care of, or is so-and-so is contacted to address their care needs, and to really be able to specify what your preferences are within that living will. So they both, again, you can do one or the other or both. And I just want to underscore here that these forms are free. This is something that you could choose to do with an attorney, but these forms are free and are available for veterans. We have them available. We can link the form, VA's form. And for non-veterans, they are available through your state. And we can share a little bit more about that in the Q&A because I think there will be questions on this slide. But while we're thinking this through, let's move right along to the next slide, which is a question that I want you to contemplate. Let's say right now you don't have your advance directive form done and you don't decide to do one. So you choose not to name anybody as a healthcare agent. So what might happen if a crisis were to occur where you weren't able to communicate what your preferences were? What would happen? How would this work? Who would your healthcare team call upon to make those decisions or to give input about what your care wishes might be? And let's see, I'm going to see what we have in the chat here. Okay, I'm not seeing any, oh, we have, yep, I'm seeing stuff come through. Provider would make the decision. Sherry said, okay, that's an interesting perspective. So thank you for weighing in with that, Sherry. Patricia says, I have 2 emergency contacts. Melanie says, I'll leave it up to my husband and providers. Okay, all right. So keep those coming in while we move to the next slide. And in the next slide, what I have on the screen for you is a snip from VA's policy, which governs the surrogate decision maker process. And on my end, the slide isn't advancing yet. Oh, there we go. Okay, perfect. So VA has a policy, which is up in the title of this slide if you wanted to Google for it to see the entire thing. And this policy would be applicable then to those who receive care within VA. So I just want to be really clear about that. And this is how it works. If for whatever reason, the person that we're providing care to isn't able to communicate their preferences or decisions with their healthcare team, then VA will first look to their named healthcare agent. If they don't have a healthcare agent, or they didn't complete an advance directive, or maybe VA is not aware of the advance directive, they'll ask for one to know if there is one. But if there is not a healthcare agent, which is the person that you would name if you chose to complete that advance directive form, then they would move next to the legal guardian, which is a court-appointed person and a whole entire process, which hopefully some of you are probably familiar with, but not very many people have a legal guardian in the grand scheme of things. So in the absence of a legal guardian, the third group that VA would go to would be the next of kin. And how is that defined? The next of kin is a relative. They have to be 18 years of age or older, so they have to be a legal adult in the following order of priority. So the first person, if there is no healthcare agent and no legal guardian who VA would look to as that surrogate decision maker, is the spouse, followed by the child, parent, sibling, grandparent, grandchild. So I want you to think about Susie's story again here, because, oh, well, the husband didn't have anyone named. Oh, she happened to be the spouse, and so that's how it would work. But I also kind of want to do a little bit of a twist. What if her niece's health condition deteriorated to the point where she couldn't fulfill the role and maybe even needed her own surrogate decision maker? They would move to her husband as her spouse if he was still able to fill the role. And if not, they would move to a child. Of course, they'd have to be 18 years of age or older. And while that seems really, really straightforward, I will just share with you in practice with some of the veterans and caregivers and families I've worked with. If there's one child, okay, that's clear cut and we can move right along. But if there are a couple of children, sometimes it's really hard for siblings to get on the same page to make a decision around their parents' situation. Not to mention if it's a blended family, and then you've got children from one set and children from a different set. So I'm just throwing that out there because I think it's important to really think through what your situation is and how, in the absence of you telling us who, or your healthcare team, who you want them to talk to, undoubtedly each state may have a little variation of this, but there will be a hierarchy that's established that will be used if they aren't sure who to talk to. So with that, we are going to move right along, and we're going to tell you a little bit more about the program that we work for in advanced care planning. And I just want to share, as I turn it over to this video we're going to watch, I just want to say that this group approach to advanced care planning that you're going to hear about was created by a VA physician at the Little Rock VA who was inspired by a personal experience with her own father. So as I turn it over to Jisa, who's going to be your next presenter after the video, we want to share the video you're going to see, which is a veteran's experience of advanced care planning. So if we can roll the clip.
And I believe advanced care planning is important and necessary. Hello, and thanks for taking the time to watch this short video. I am a combat Army veteran, and I believe advanced care planning is important and necessary for us all. When I first began receiving care at VA many years ago, I was approached on numerous occasions to fill out the VA Advance Directive. However, I didn't complete an Advance Directive until recently. Each time I was approached about filling out the Advance Directive, it was never communicated to me in a way that motivated me to want to complete it. I associated Advance Directive with death and dying, and I wanted to avoid at all costs thinking about these topics. It wasn't until I participated in a group called Advanced Care Planning Group Visits, where there were discussions about future healthcare planning, that I understood the real benefit and need to complete a VA Advance Directive. Listening to others share their stories about the challenges they face due to not having a plan in place when a loved one became unavailable to communicate their needs really helped me to understand why this is so important. I began to really think about what I would want if something unexpected happened. Toward the end of the group, each participant was encouraged to identify a next step that they wanted to take. And I thought about how I had not communicated my wishes nor desires with anyone if they needed to step in and make decisions for me. And this prompted me to have a discussion with my spouse. We talked about the use of life-sustaining treatments, and I realized that we had different views about this. However, we were able to come to an understanding about the importance of honoring my wishes, and we were able to complete my VA Advance Directive together. This gave me a sense of peace and hope that my family may not go through some of the challenges that I had heard from others due to not having a communicated plan in place. I hope my message relays the value of participating in discussions about future healthcare planning and how it can change one's mindset about having a plan in place in case something unexpected occurs. My fellow veterans, please contact someone at your local VA and ask them about the availability of advanced care planning groups. You may come to have peace, as I have, in knowing that your wishes have been made known to the people you love, and to the members of your healthcare team.
All right, wonderful. Thank you so much, Laura. You're getting some great kudos in the chat. Hello, everybody. I am Gisa Hernandez, and I'm very happy to be here with you all today. So thank you all for tuning in. After watching that veteran experience video, you all may be thinking about some of your own experiences with having these discussions with your loved ones. Or even with your own healthcare team and how that has resonated with you or maybe not resonated with you on an individual basis. So this here is sort of our formal description of ACPGV, and I'll be telling you a little bit more about this program, but I'll summarize it by just saying that it's basically a group discussion amongst peers, and the topic being about advanced care planning. At the end of the group, everyone is encouraged to identify what we call a next step in planning for any unexpected healthcare needs that may come up in the future. And some of you may be already familiar with different groups, whether it be at the VA or elsewhere, but ACPGV is actually unique in several different ways. And we'll talk a little bit more about that here in our next slide. So as I mentioned, some of the groups that you may be familiar with may have been a few sessions long, many sessions long, or even ongoing groups. But ACPGV is just a one-time group. It's 1 hour long. Although everyone is always invited to come back if they would like maybe a refresh on the topic, or for example, if they went and talked to their loved ones about some of these conversations and then brought up some questions, they can come back. Or if maybe the first time that they came to a group, they came by themselves, and then they want to come back with their support person, they're always welcome back. Because the model of the group really emphasizes the importance of peer discussion, it's typically kept small with only about 8 to 10 participants per group, so that everyone really benefits from the content and the process of the group. Participants can be veterans and caregivers, or sometimes or usually a mix of both. And like I mentioned, loved ones and the support person are encouraged to attend with whoever the identified participant is. Currently, groups are being facilitated in several different service areas. Of course, VA primary care clinics being one of them. Also, some of our community-based clinics. And several different mental health groups are also facilitating ACPGV groups as well as some community spaces who are hosting us, whether that be in churches or veteran service organizations. You might be familiar with some of those in your local communities. And lastly, there is a 2-week follow-up after the group. So participants will receive a call to discuss some of the progress that they've made with that next step or their goals. If, in case they need any additional support, again, if they have questions or if they just need to modify some of the goals that they've set for themselves. So there's plenty of support offered after the groups as well. Okay, on the next slide, I know that we've already mentioned the model focusing on the group discussion, but I want to just talk a little bit more about that. The impact that it can have on the participants, because I know that at times folks are reluctant to attend groups, and oftentimes if they make it to a group, they're reluctant to share. So clearly that's a lot that, there's a lot that we can gain from having individual sessions with either the providers or your social worker or case manager about this topic on an individual level. But sometimes it actually feels like a lot less pressure when the entire conversation is not just about you. So sitting in a room with your peers allows you the opportunity to see and learn through others' eyes and through what their experiences have been. So even a participant who chooses not to share and just sits there quietly and listens in group, we still consider that to be an active participant if they're listening, because they're still learning. I know I've facilitated many groups where peers have been able to relate to each other and motivate each other in ways that I could never accomplish as a clinician. The facilitators do have a clear role in guiding the conversation of the group and, of course, providing accurate information, just like Laura did for us today about definitions and forms to use and things like that. But I think one of the most important pieces is providing that safe space for peers to support each other and share their different perspectives. So with that being said, on the next slide, you've now learned about why advanced care planning is so important and how talking amongst peers really helps to learn and at times initiate that process. So we want to pose this question. If you aren't ready to talk with your loved ones about advanced care planning, what would need to happen for you to start that conversation? So feel free to place your answer in the chat box or just give it some thought. But I'll tell you what we often hear. What we often hear is, I don't know how to bring it up, or that it's easier when someone else brings up the topic. We've also heard it's easier to convey what I would or would not want when I hear about what others have gone through. And certainly it's easier when I know that I have a network of support. And that's what ACPGV aims to do. So think about what would work for you and your loved ones. Let's walk through what your next steps are going to be after today's presentation. On the next slide, we have 2 examples of that next step question and responses that I'd like you, maybe if you have a pen and paper handy, or if you want to type, to just think about where you are in your own process of planning for any unexpected future events. Whether that be discussing your wishes with who you know your healthcare agent is, maybe asking them if they're willing to serve in that role, or maybe just attending a group so that you can learn a little bit more and then reflect on the things that you may not have thought about before. So we know it's simple enough to say, oh, I'll talk to family, or I'll talk to Susan, like our example here on the screen. But you're more likely to follow through with your goal if you specify the when, the who, how, and where. So think about what that's going to be for you, and just take a few seconds to jot it down or give it some thought. For those of you who are interested in attending a group and possibly bringing your support person, on our next slide is a map of all of our active ACPGV sites. So, and we say, you know, maybe attending a group, possibly bringing your support person so that they can learn more, but also so that you are not the only one initiating that conversation. It's not just coming from you. It's a group effort. So as I mentioned, these are the active sites across the country. Sites are offering groups to both veterans and caregivers. And we'll post a link to our directory so that you can make contact with somebody at your local site. If ACPGV is not currently offered at your site yet, you can always reach out to your social worker or your primary care team to ask about advanced care planning as well and have an individual conversation. There are plenty of resources and ways to support you in this process, so you're certainly not alone in doing this. And that concludes our presentation. I think we have some Q&A coming up, so I will turn it over to our moderators.
Thank you so much, Laura and Gisa, for that informative presentation. Quickly, before we move on to our Q&A, I'd like to take a moment to introduce Mary Hahn Ward, who is joining us. She is a 2016 EDF Fellow Alumni and the host of this Caregiver Life podcast. She's authored 3 books, Thinking Through VA Benefits and VA Care, a resource for veterans with ALS and their caregivers, Pause at Work, and Letters Home. Mary has been a caregiver for her husband, Tom, since 1993, when he contracted an infection that left him with cognitive impairments and disabled from his work. While caring for Tom, raising their 2 children, and working, she completed her undergraduate degree and 2 graduate degrees. In 2010, Tom was diagnosed with ALS, also known as Lou Gehrig's disease, service-connected. Mary has been a fierce advocate for years for caregivers, veterans, and ALS. Mary, thank you so much for being here and sharing your perspective with us as a caregiver. Our first question will be for you. Are you able to tell us about your experience with advanced care planning?
Yes, I am. And thank you so much for having me. It's such an honor to be able to share some of our experiences. We did our advanced care planning a few years after Tom was diagnosed with ALS. We probably should have done it a little bit sooner, but we did get around to it. And he's had ALS for 12 years. So when we had done this about 7 years ago, and I do find that I revisit my binder and all the forms that are in it at once a year. I do a once a year like checklist because things do change. Like Laura and Gisa was saying, things change and your needs change. And I did mine at the same time that my husband did his.
Great, thank you so much. And are you able to talk a little bit about how you approached that conversation and how you went about gathering all the materials that you needed?
Sure, that's a tough conversation. And you would think really with the diagnosis of ALS, it would be a little bit easier because we do know that, it's a terminal disease. And so we have to sort of get our affairs in order because we really don't know how long somebody's going to live with the disease. And it was a challenging conversation, and it's an ongoing conversation for us. As he gets older, his desires change about what he wants at the end of his life. But his advance directive is such that there's movement in there for him to make decisions that would still be good in his advance directive, that would still be followed in his advance directive. And we spoke with our children about which roles that they wanted to play. We have 2 adult children, a daughter and a son, and which ones, who wanted what, who wanted to make the decision that there was time to let us go. That's a hard decision. But we did ask them, and our daughter said, not me, I don't want to do that. And she was very clear about it. So we honored that and respected her, and we put that in our paperwork as well. But I will show you real quick. I'm obviously not going to go through it, but this is really what helped me guide all of our end of life planning, really our advanced planning. It has I pulled out all my files, and I took out the VA files, and I took out the VA compensation letter and who his doctors are and what our passwords are to banking information, life insurance policies, disability policies, all the things that I thought they needed to know, the power of attorney, the healthcare directives, the living will, everything is in there. I don't know that it's perfect, but it's a pretty good start.
Yeah, absolutely. Thank you so much, Mary, for sharing that. And that kind of leads into one of the questions that we received, and this is either a question for you or Gisa or Laura. And having these conversations with family, if you have multiple children, how do you decide which child to have this conversation with, or do you have this conversation with the entire family?
Well, I think I'm going to leave that to the social workers because I have 2 kids, and I asked them what they felt comfortable doing. I did let them know they had to be involved because they had to help each other. So I sort of didn't leave a lot of wiggle room in that, but then they made decisions of where their comfort level was.
And wow, Mary's approach is phenomenal. I was loving your sharing about that. And so there isn't a sort of a cookie cutter approach, right? So I'm going to share just some thoughts and ideas, but you really do need to kind of tailor it to your own situation, your own relationship with your own children. And I'm going to start by just sharing with you a group that I observed. There was a participant in the group who said, I have my daughter named, but I know she won't be able to do what would be required of her after listening to the other people's experiences today. And I don't want to do that to her. Like, I just don't want to put her in that position. My son, on the other hand, he can kind of disconnect from his emotions and he can just sort of do the tough things and not let the emotions take over as much. And so I think it's really important to have the conversation with all the children, whether that be in one group setting, whether it be having that as they're able to talk through it. I also think, from a practice perspective, when the kids don't all know the plan, it really can be challenging if you've named someone they disagree with you naming. And so it can cause tension and problems sort of down the road if something unexpected happens. So there's a lot to consider with that question, but communicate would be my best advice. And, you know, Mary's approach was amazing because it gave them the option to say, not me. Like, I love y'all. I don't want to be the one to fill the role.
Okay, thank you, Laura. We had another question asking if there are two family members who are taking care of another member of the family, are they allowed to have two sets of paperwork? Is that allowed?
That's a great question. And I saw that one come through, and it made me wonder if you've appointed one person, but you've like had the form copies of the form so that everybody has the same kind of copy of the form in different sets, in different settings where they're needed. Or if what you mean by the question is, I've named someone for this and another person on this set of paperwork. If it's that scenario where I've sort of named two different people, I would encourage you to really kind of think that through, because you wouldn't want to set up a situation where the two named people both feel like they should be the one called upon. And then there's a lot of sorting out that might have to happen as far as which form is more valid, or which form was really the form that was intended. Or, you know, there's a possibility, I'm thinking of a case that I was involved in my career where there was questions about the dates. So one was dated, let's say yesterday, and the other one is dated today. And so the most current one would be the one that would get used, or at least in that case. That's what the regional council in VA advised us to do.
Great, thank you. And then I know you touched on this a little bit in your presentation. You shared that VA has some of the forms available and the states do as well. We had a question on if there are free or affordable resources to help veterans and caregivers create a will and create these advanced directives. Are you able to share a little bit more about those?
Yes, absolutely. And on the very last slide in our slide deck, there are actually some hyperlinked resources there. Let me just back up and say the VA form can be used by anyone, veterans and non-veterans. However, what's most important is that if you are not a veteran, that you make sure that the place where you receive your care will honor whatever form you use. So if you receive care outside of the VA and they really want the state form as the form, then you would just want to make sure that you kind of consider that when you decide which form, which kind of version you want to use. The Conversation Project is one of the hyperlinks within the slides, and they have kind of a resource hub of all of the different state-specific resources that I would point people to take a look at. And then if you have questions, because maybe you have already Googled for your state and it came up with a whole bunch of different things and it got more confusing than helpful, if you have a question, I would always make sure to ask your healthcare team, like, is this the form? Like, is this the one that the health system that you access considers to be, you know, the one that they prefer? One other piece on that is if you do work with an attorney, that can often look very different than sort of the state forms. So I just want to make sure to point that out, because some people do choose to go that route.
Wonderful, thank you. We had another question come in. As a surviving spouse, would I be able to attend the AVP groups at the VA to give my insight as a spouse and how important it is for the veterans to have an AVP in place?
That's a great question. And really, it makes me want to give you our national program email so we could connect and talk through some of the logistics on that. Yeah, I would love to kind of explore that possibility more if the person who asked that question is up to doing that.
Yeah, so maybe whoever asked that question, I don't have access to that, but maybe they can put their contact information in the chat for the host and panelists, and we can make sure to reach out to you and get you connected. All right. We have another question. Is there an appropriate power of attorney, specifically if your veteran is going to be inpatient for an extended period of time and contact may be limited, yet certain decisions still need to be made?
Not to my knowledge. I would just go back to the VA Advanced Directive, and within it, it has the durable power of attorney for healthcare. So it is very healthcare specific. So I'm not sure about those other decisions need to be made part. There may be other things that have to do with their affairs that aren't related to healthcare. But no, there is not a different form, whether you're in the ER or whether you're outpatient or inpatient or, in a domiciliary program that might be several months long. It's all the same form as it relates to the healthcare component.
Wonderful. And I know we do still have a number of questions, but also want to be mindful of everyone's time. I do want to say thank you, Laura, Chisa, Mary, for answering questions and for being here today. If you submitted a question and it was not answered live, we have taken note of all of those questions. So we'll be sure to reach back out to you so you can get a response to those questions. Before we wrap up this afternoon, I'd like to congratulate the winners of our giveaway: Kathleen Lowry, Sherry Burke, Melanie Rodriguez, and Patricia Asuncion. So please email us directly at events@elizabethdolefoundation.org with a good mailing address, and we'll get that prize out to you. Again, Laura, Gisa, and Mary, thank you so much for your time today and for sharing your incredible wisdom and resources with our community. For folks joining us, if you're not already registered with HHCC, we encourage you to join our Facebook group for updates. Our group is an inclusive community for military and veteran caregivers of all service areas. If you care for a wounded, ill, or injured service member or veteran, we would love to welcome you into our community. So please visit hiddenheroes.org/register to get started. We've also recently launched our Hope Fund for critical financial assistance. If you need financial help, learn more and apply for our grants at hiddenheroes.org/hopefund. And lastly, be on the lookout for a follow-up email from us that will include the recording of today's episode, VA resources and information, and the link to register for Hidden Heroes. Thank you everyone for joining us today, and big thanks to our partners at Wounded Warrior Project for supporting our C3 series. We hope you enjoyed today's episode.